Next one here is from Dr. Ryder from Virginia. I'm concerned about vitamin D level to tell my patients is optimal because multiple things have come out recently about different. And it's interesting. Yes, there have been all these different studies on all-cause mortality, on cancer, on various things. Interestingly, they're not on cognition. They're not on Alzheimer's disease. So we're focused on what can we do to get best cognition for patients. And there's no question studies have suggested low vitamin D is associated with increased risk, Snips in the vitamin D receptor associated with increased risks, and treatment with vitamin D associated with improved cognition. And I'll put a reference here for one of the studies that showed that treating with vitamin D alone enhanced cognition. There's the other thing, which is not the same disease, MS. They're immune dysregulation, both, of course, very different, more on the adaptive side when it comes to MS, more on the innate side when it comes to Alzheimer's disease. But in the case of MS, they found that people did better with vitamin D levels over 50. So I completely agree with you. It's a concern, and people are saying, oh, there was that famous study where the optimal for all-cause mortality was 39. So, okay, you want to put someone at 39, fine. We see it all the time, though, with people with cognitive decline coming in with levels of 18, 19, 21, that sort of thing, just these very low levels that probably are not helping them. And of course, vitamin D binding to its receptor has an impact on transcription of hundreds of genes, a number of which are involved in synaptogenesis. So I feel your pain here. There's this concern about where do we tell people to go? I still like 50 to 80. I recognize that there's that study with the all-cause mortality at 39. I also would recommend, as one paper suggested, just get people outside more. The argument was it may not be specifically levels. It may be that people who are getting outside and getting more exposure might actually do better. So, Anne, where do you like to see your patients' vitamin D levels?
Yeah, I still aim for 50 to 80. 80, close to 80 has been shown to be very significant in terms of protecting bone mass in postmenopausal and elderly men. And that's something that a large percentage of my patients suffer from osteoporosis, borderline or significant osteoporosis. So I worry about that. A lot of these studies that are being cited are observational studies, not all of them, but observational studies are problematic. They don't show causality. And, you can think of a lot of reasons where someone who doesn't feel well, has multiple illnesses, might be thinking more about, okay, what can I take? And they're taking a high dose of vitamin D, among other things. So I don't know how strong the evidence is yet. I'm trying to keep up with the literature on it, but I do still aim in most people, unless they have parathyroid disease, I still am aiming to get their vitamin D up around to at least 50, if not 60 to 70.
Yeah. I think that's still a good target. Again, all these various studies are not looking at Alzheimer's disease, unfortunately.